So my name's Jessica. This is my daughter Kay. She's 4 years old. Kay was born with Down syndrome, and in June of 2024 she was diagnosed with type 1 diabetes. It's scary. I mean, it's definitely scary because even with Down syndrome, you never know what health complications they can have. It's just like every other child. Everyone's different. I could have health complications that she doesn't, or vice versa. So all of the unknowns for that has always been in the back of my mind, like what will pop up? Is something else going to come up? Is she going to need another surgery? It can be hard to get, access to pediatric care just because, there is long wait times or there isn't enough doctors. Her ENT that she had did a tonsils and adenoid surgery on her when she was about a year old and literally scheduled it right before she left the state to move and scheduled her follow-up, and then she left like the next week. And ever since then, we've had an adult ENT because they haven't found a replacement yet for pediatrics. So each appointment is just like, everything's good, okay, see you later, Like you can get established with a doctor and then they leave. And then so they're like, okay, well, we'll call you if another pediatric one replaces them. Or, you have an adult doctor who doesn't really know enough. Like, they know enough to go to the checkups and, but I mean, if they need surgery, they're not pediatric. So then you're like, you want to trust them, but should you? Like, it's tough. For Kay, she has hearing loss in her right ear, so we see an audiologist. We see an ENT, just because she's had sleep apnea, so she had the tonsils and adenoid surgery, so we always follow up with that. Has had several ear infections, so there's always that aspect too. So every 6 months we do both of those. Originally she's seen a cardiologist, luckily was cleared from that. But since she has diabetes, we see an endocrinologist as well. About every 3 months we go and see that one. So there's a lot of specialists that she does see, a gastroenterologist just for stomach issues at times. So there's a lot that we see. Seeing all her doctors in one day would not be feasible, especially because they are at different locations. But I've had times where we've had one specialist in the morning and then there was a long wait just waiting for the doctor. So then we've had to hurry up and go to the next one. When I thought we would have enough time in between, we didn't. So, it's not really feasible unless you have one early in the morning and then one maybe later or early mid-afternoon. You might be able to do it, but you just never know. I think things that definitely can be improved upon, aside from just needing more pediatric doctor specialists as a whole, is doctors who take their time, because there's often times that I do feel rushed. I get it, they have a big patient load because there's not a lot, so I'm sure there's a lot of stress for them in that too. And especially after you're waiting in the room for like 30 minutes or an hour, and then they come in and they want to spend 5 or 10 minutes with you, and then they're like, okay, looks good, or see you in 6 months, so it can be hard.
What are some things that you've seen that are going well for pediatrics in Nevada? Any good news?
Yes, we have the new genetic specialist, which is huge for us. I'm always interested in learning about genetics and everything that kind of goes into that. He was great. He, asked me, do you have any questions? I'm like, I have a list. And I pulled out my phone notes and I'm just like, let's start here. And he listened to all of them. He listened to all my concerns. But we do have doctors that do listen. Her pediatrician's office has always been really great, especially when I came in there, suspecting that she has diabetes. Not luckily, but it runs in my family. So anytime I've gone in there and it's like, here's a concern that I might have, do you have a test for that? They're always like, absolutely. They've never brushed me off like, oh, you're just worrying too much. They're just like, sure, what do you need? I mean, honestly, something that would change things for us as far as pediatric healthcare, just having more pediatric specialists. I think that would prevent long wait times in the doctor's office and long wait times when you need to schedule. I know like a lot of times it's average 6 months to a year for a follow-up, but what if you need something in between? It's impossible to get in, so it makes it hard to, get the care that you need. Especially if something comes up, you're just like, okay, well, I guess we just don't know, or, have to look at other options if there is any.
So how has your family been affected by the lack of having all the specialists that we need. Have you experienced that yourself?
Yeah, we've had several doctors, and actually her first endocrinologist, newly diagnosed diabetic. I had no idea, like I have some family, but I didn't know the ins and outs and everything that comes with it. So when we go to these doctor's office, I'm going in blind and I'm expecting them to teach me and to be there, and sympathetic and, just know that we're new, so we don't know anything. The first doctor that she had, I switched from them after our first appointment because the wait time was very long. So we were in the room waiting for her for about over an hour. So, as you can see, kids aren't always super patient and they don't know why they're waiting. And then when she goes in there, Kay's upset because she's been waiting, so I'm trying to listen to what she's saying and take in any knowledge that I can as a mom with a newly diagnosed child with diabetes. And it's hard because at that point she's done, she's ready to go, she's irritable. Part of it could be because her blood sugar's high from diabetes, because we are just trying to figure it out. So going in there and just not having the doctor be able to also take the time that we need and thoroughly explain stuff, that's hard. A freestanding children's hospital here would be a huge benefit. What I'm looking forward to as well is the children's, the lab, because it's so hard to find phlebotomists and just a lab that can do blood draws on kids, at least the first time. Several times we've had to get blood drawn for Kay and it's taken 2 times and I'm like, okay, no more. We'll come back or we'll go somewhere else. Having somewhere to go, I would drive across town for that.
What would you do with the extra time? What type of things does your family like to do, and what could you do with that extra time?
She likes going to indoor playgrounds. We like just even staying at home. Just the ability to just relax at home and play and do what she wants is a huge benefit for that. Not to have to worry about packing up all her stuff. Do I have all her diabetes supplies? Do I have snacks? Do I have, an extra insulin pump or a monitor? It all depends on how long I think we're going to be out and what I'll need, because you don't want to be left unprepared. I think my biggest thing is that for pediatrics, it's not just about having the amount of doctors that we need. It's about having the doctors that are personable and that do listen to our concerns. I've noticed that as more pediatric doctors leave, the ones that have been good, they're getting so busy that now they almost feel rushed. You're going, and at one point you had great experiences and now it's kind of less. It's not horrible, but you can just tell because they're getting so busy. They don't have a choice. They're trying to help everyone. They're taking on the patients that another doctor had to drop because they left. Or are they gonna, finally be able to hire and bring in more pediatric specialists so the care is spread out evenly? It's hard.
Kay, is there anything that you would like to say?
You want to say something? You say hi?
Bye.
Bye.